My name is Abigail Mamukuyami, and in this segment of our presentation, we will discuss the disadvantages of MRIs, MRI versus CT comparison, and we will conclude our presentation with the video going into more depth of what an MRI is. Disadvantages. MRIs have been known to make patients feel uncomfortable and claustrophobic, mainly because the space is so tight and so small. The magnetic field and the loud noises can actually make someone feel very enclosed, uncomfortable, and sometimes leads to panic attacks. Disadvantages. Part 2. MRIs can also be affected by movement, such as coughing, swallowing, or moving around, which can make the images less clear and not as reliable. Disadvantages Part 3. Bone and calcium do not show up in MRI scans, so bone diseases such as osteoporosis cannot be detected when using an MRI scanning. CT versus MRI scanning. The image on the left is of an MRI scan, and the image on the right is of a CT scan. As you can see in the differences, the MRI has a more detailed, clearer image than the CT scan. The MRI shows more of the tissues and internal body organs, while the CT scan just only shows the surface. The MRI would be more useful for finding deep tissue issues. CT versus MRI continued. As said before in the other slide, with the comparison of the pictures, an MRI is better used for diagnosing issues in your soft tissue, joints, tendons, and ligaments. To conclude this presentation, MRIs are better than X-ray and CT scans because instead of only showing the surface, MRIs show a detailed image of the human organs and the tissue and body movement and activities. Here is a detailed video of how an MRI is conducted.
Ailment that cannot be detected by a traditional office examination, an MRI may be necessary. When an MRI is administered, the patient lies on a retractable platform which enters the center of the machine. Upon entering the machine, the patient is scanned by one of several magnetic coils that emit a radio frequency pulse targeted at the specific region to be